Asia's medical claim costs remain persistently high at 13%, outpacing inflation by 5 times despite signs of a slowdown globally. The Philippines, Indonesia, Malaysia, and Vietnam have reported the highest medical trend rates of 21%, 19%, 15% and 15% respectively, says Mercer Marsh, and the costs are likely to remain high. With us now for more from Shanghai is Stephen Yu, the Benefits Asia leader at Mercer Marsh. Good to see you, Stephen. Welcome to the program.
Thank you.
So I'm counting 8 out of the 10 markets in Asia is going to see medical claims costs exceeding double digits this year. What's driving that?
Well, Kathy, Mercer Marsh Benefits Health Trends 2025 report highlights that while the medical conditions driving claims in Asia have remained largely consistent over the last decade, their financial impact is increasing. Insurers in nearly all markets project medical claim costs to increase by more than 10% this year, with Asia looking at 13%, the Philippines at 21% for 2025, as you just said. Insurers surveyed in our report actually highlighted several key factors contributing to the rising medical claim costs. 81% said that the increased insurance utilization driven by a higher incidence of health conditions, and 73% pointed to the ongoing medical inflation and a shift towards more expensive or advanced treatments. One of the key contributors is the cancer claims, as it continues to significantly impact health and claim cost, Kathy.
It is. So how do we deal with that? I've seen in your report, and it's quite an expansive deck here, that cancer is really the #1 issue. So what would you recommend then so that insurers won't have to cut costs while expanding coverage?
Well, Kathy, the insurers are playing a bit of the catch up here, and the projected rise in medical claim costs in the Philippines is driven by several factors, including medical inflation, changes in treatment mix, and increased utilization patterns. Specifically, our report actually indicates that medical trend rates are influenced by rising costs associated with advanced treatments and an overall increase in healthcare service prices. In Philippines, the healthcare system faces different pressures, as do all the different markets. So in the Philippines, for example, the high COVID-related claims are still affecting margins, while there is an increased volume of utilization and a shift towards a higher cost treatments and medications. Additionally, there are medical staff shortages, as many healthcare professionals leave for better paying opportunities abroad. So actually, this situation is compounded by a significant increase in medical fees and salaries, which have risen by approximately 25%, as set by professional healthcare organizations. And these factors collectively create distinct challenges to the healthcare system in the Philippines, Kathy.
Multifactorial when you come to think of it. But then I was just reporting that in April, inflation's fallen to a near 5-year low. So what impact might that have in easing up the medical inflation that we're seeing here in the Philippines?
You're right, Kathy. The actual inflation rate for Philippines was 6% in 2023, and then 3.2% in 2024, and projected as 3% for 2025. However, the medical trend rate 2023 is 24%, which is 4 times higher than inflation, 7 times higher in 2024, and projected to be similar in 2025. So our data indicates that the medical trend rates in the Philippines are significantly higher than the general inflation rates, suggesting that medical costs are rising at a much faster pace than overall cost of living. And this trend highlights ongoing challenges in managing healthcare expenses in the region. As a reference point, Kathy, while Asia's medical cost is projected to be lower than the Philippines at 13%, it is still outpacing inflation by 5 times. So it is not unique, as we're seeing claims going higher than inflation, Kathy.
Right, but there's got to be a silver lining here, Stephen. Minding that gap between what workers want and what insurers offer. Really important. So how do we narrow that gap?
First, I would suggest let's look at the preventive cancer screening. I mentioned one of those things before. Our report emphasizes the importance of it as a means of early detection, which can significantly reduce the risk of higher claims related to later diagnosis. Half of the employee indicated that these screenings are a helpful benefit. Yet in Philippines, as with the rest of Asia, trails behind other markets in other regions in managing cancer as an intensifying risk, with 26% of the insurers in Asia offering preventive screening in their health plan coverage compared to 43% globally. So, with those notable disparities between insurers and the workforce in Asia concerning the inclusion of preventive care and screening health benefits, it is essential for employers to develop a meaningful benefit strategy to meet the unique needs of workforce. This often requires ongoing dialogue with advisors and insurers to ensure that offerings remain relevant. Kathy.
And also on the employees, the onus is on us to just keep ourselves well and get tested. Well, thank you so much, Stephen Yu of Mercer Marsh Benefits. Appreciate the insights.